Okay, so I think we're going to go ahead and get started. And before I turn things over to Jim, I just want to say thanks everybody for attending today, taking time out of your schedule and listening to what we've got to say about accreditation. So before I turn it over to Jim, I just wanted to go over a few housekeeping items. I'm sure lots of us are very familiar with Zoom now. We've been kind of forced into doing a lot of online listening and presentations and that kind of thing. So in case you aren't familiar, we do, I just wanted to point out that there is a chat box. If you hover your mouse over the bottom of the Zoom panel, it'll give you a black bar and it has a chat function, also a raise hand function, and a Q&A function. If you have any questions or any issues while this is going on, feel free to put it in the chat. We're going to reserve the Q&A box for questions specifically for Q&A time at the end. So if you think of something along the way, go ahead and put it in the Q&A box and we will answer it at the end of the presentation. So a couple of other reminders. We are recording today's webinar, so it will be available in about 1 to 2 days. It takes us a minute to kind of get that all situated. So we will have the recording available on our webinar library, as well as a link in the follow-up email. So look for that in a couple days. And also just to remind you that this presentation is worth 1.5 business credits. So be sure to take the quiz for CEUs, and I will put a link for our SurveyMonkey quiz for credits in the chat box at the end of the presentation. That way you can copy it out and go ahead and take the quiz if you want to while everything's really fresh. And you can put it in your browser and go ahead and go straight to the quiz. There should be a survey as well as soon as the presentation ends, requesting some feedback about how you thought the presentation went today. So we hope that you will also fill that out and let us know what kind of topics you want to hear in the future and how you think the presentation went. So I think it's time to turn it over to Jim.
Hi, Megan. Thank you so much. Thank you for the introduction.
And I just wanted to say a few words, if that's okay with you, Jim, for anybody that doesn't know you. Jim manages our ABC outreach development, and he spends a great deal of time working with business owners, helping them to navigate the accreditation process, improving their business. And Jim speaks at national, regional, state, and chapter O&P, pedorthic, and mastectomy conferences all over the place. Currently, he's not doing much of that, but generally that's where you will see him. He also speaks at universities and colleges representing ABC. So he's got lots of information, lots of experience, and he is definitely our face, and we look forward to putting him back on the road. But for now, we're going to be doing lots of presentations like this. So Jim, take it away.
Thank you so much, Megan. I think if you all read between the lines, Megan says we want to send them back out on the road and get rid of them. So thank you. We appreciate it. Before we start, I'm going to give you a couple little warnings. One, I am speaking to you from Virginia, Fredericksburg, Virginia, and we are in the middle of a windstorm right now. And we had one about 4 or 5 days ago and the power went out. So if there's any pause, don't worry, we'll get it all set, okay? So if you hear any pause, we appreciate your patience with that. But I think before we start, Megan and I have a few polls we'd like to do to kind of get a feel. Normally, when we're live in person, I love talking with everyone in all the attendees and the audience. Right now, it's a little more difficult to do that. But let's go ahead and start with a poll right now. Megan, can you bring up our first poll? It's going to be very simple to respond to. And our first poll is, what is your role at your boutique? What is your role within your business? Are you a business owner or manager, administrator? Are you a certified mastectomy fitter? Or are you more than one of above? Or maybe not. So if you could go ahead and make your choice, and we'll give you about 10 seconds to do that. Hopefully you'll know who you are right now. And then we'll go ahead and take a look at the response. So Great. We have 43% are business owners. Then we have 14% administrators, and 43 a mix. Okay, 43% is a mix. That makes a lot of sense in this profession. It truly does. Thank you for that. We're going to move on for this. Before we go any further, I would like to remind everyone that the last 8 or 9 months that we've been hit with the COVID virus since last March that really became so prominent. ABC has created a COVID update page, COVID-19 update page. And if you have any questions regarding what ABC is doing, that Medicare is doing with this, facility accreditation that we're going to be talking about today, certification exams, continuing education opportunities, which are growing greatly because of the COVID virus, especially the online opportunities, please go to our website, abcop.org. I'm going to give the website again at the end of our presentation. Please go right ahead and we update it whenever something happens that we feel you should be aware of. We update it right away. Sometimes we update it 3 or 4 times a week. So please feel free to go ahead and take a look at that. So let's get into our area. ABC. Depends on how familiar with ABC. ABC does basically 3 things. We're like a 3-legged stool. We do certification, continuing education, and accreditation. And today we're going to focus on accreditation and compliancy with that accreditation. I think I probably met all of you listeners, all of you attending. I probably met you face to face over the last 9 years. I've been almost with ABC. And you hear me talk about validation. Validation is the key. Documentation is necessary. If it is not documented, it is not complete. It is not done. It has not happened. You've heard everyone talking about that. And so we're going to focus a lot on the documentation today. Documentation is the key to validation. You're going to hear me say it over and over again, but I have some pretty good questions about that, I think. So let's keep on moving. How about another poll? Megan, can you bring another poll up for us? And this poll is in regards to, is your boutique accredited with ABC? Is your business accredited with ABC? If you just say yes or no, this is anonymous, we don't know, or you're considering accreditation, that's the third option. Take a few seconds and go ahead and click on that. And then our responses are 100%. I don't think we've ever had a 100% response. Fantastic. That's great. Now, normally I would follow up with, if you are not accredited with ABC or another organization where you're not accredited, probably about 95% of the information we're going to talk about today is still applicable to you. So it's fantastic. So you're all accredited with ABC, so this is going to nail it. It's going to be great with you. We're going to move on forward here. So for your first time accreditation, we're going to ask you to apply when your practice and your facility, your business is prepared. What we don't want is we don't want to send a surveyor for your on-site surveyor if you're not ready for them to show up at that point. But renewals is what this is, I think, mainly what we're focusing on today. We're going to ask you 6 months prior to your expiration date to go ahead and apply. We're going to send you reminders for renewal application by snail mail, by email. And what we're doing right now is we are giving you a 4-week window of telling you when the surveyor will arrive. That's not something we used to do, but we're giving you a 4-week window, and I think that's going to help making sure you're prepared. We're doing that during the COVID virus right now, the COVID-19, just to make sure that you were there, make sure that surveyors there being able to do their job and perform their survey itself. So about 4-week window. There's an option that maybe a lot of you don't know about, and those are blackout dates. ABC offers blackout dates. If you would have a period that you're not going to be in, if you're the owner or the business manager and you want to be there during the survey and you're not going to be available, let us know those dates. If you let us know those dates when you apply, that would be the best way to do it, but we need at least a 30-day notice. And what we will do is we will work our hardest to make sure a surveyor does not arrive at your practice when you are not there. So take advantage of that, but give us as much notification as you can, at least minimally 30 days. So take advantage of that if you can. Now, preparing for your survey itself, I mentioned the documentation is key to validation. Documentation must be available. Make sure your documentation and all of your records are available to the surveyor itself. I've used this example before. I mean, you may have heard this, but I'm not a surveyor, but I do have the privilege of going on some of the surveyors with our lead surveyors. We get to the exit and closing interview, and we let you know whether you're compliant in different standards or not. Well, we told the one business owner that he was not compliant to standard because this documentation was not there for us. He left and came back a few minutes later, and there was the documentation. He had it all in the files, and we went through it, and it was good. He was now compliant if he kept it in the correct place where it needed to be. And so we want to make sure that your documentation is available. We're going to ask, we're going to work with you. We want you to do well in this survey. Other organizations, if Medicare comes in and does an audit, they may not ask for things that are not in the folders, in the files, in the patient's charts. They may not ask for those, and they may just walk away afterwards and say you were not compliant. So we're going to work with you on that, but make sure it's available. We ask you to prepare your practice and your boutique and your business and your facility, prepare your staff, let them know that a surveyor from ABC will be coming at some point and what they're going to be doing. They're going to be spending some time with you that day. They're going to be spending some time with your staff and going through your business itself. A standard for ABC is we do need a contact and a backup contact. That's also a Medicare standard. If you have Medicare patients, CMS patients, we need a contact and a backup contact just in case. There was a business that Woody went into once with a surveyor in the morning, and the business owner was not there, but there was a person standing behind the counter, and they were the contact, and they were not doing any business at all, but there was a possibility that ABC surveyor was going to show up that day to start and conduct the survey. Well, it just so happened, Murphy's Law, we walked in and there we were. So we were able to start the survey while the business owner was in the hospital for a very brief emergency room visit. And we were able to get about half of the survey done by the time the business owner came back to the business itself. So we need a contact and a backup contact. And as I mentioned, our surveys are unscheduled. They're unannounced. We are a deemed authority by Medicare. We are not in any way affiliated with Medicare whatsoever, but Medicare has made us a deemed authority to be able to perform these accreditation surveys. And because of that, we have rules we must follow with them. Now, the surveys we must follow, they're unscheduled and unannounced. But I will say that you apply for your accreditation survey. We will give you a 4-week window, so you know within that period the surveyor is going to show up at that point. So the surveys themselves, they're located all across the United States. They have years of practitioner experience, years of experience of surveying. ABC gives them really extensive education and experience to become an experienced surveyor with ABC. And we continue that education throughout their surveying career. And one of the main things that we're very proud of is we have the consultative approach. We're going to come in, we're going to work with you. Now, their main job is to make sure that you're compliant with all of the standards that apply to your business. But we're going to work with you hand in hand. If we see things that can be fixed and corrected while we're there to make sure you're compliant with the standard, then we're happy to do that. We're going to work with you, okay? We want you to do well on your survey. So let's take a look very quickly at your survey. We have an introduction. They're going to arrive. We're going to give an introduction. They're going to show you their badge. They're going to show you their identification from ABC. We're going to do a meet and greet and your business tour. We're going to do a little safety checks around. They will need a workspace. If you have electronic medical records, then they're going to need a monitor. They're going to be able to log into that. It will take them, it doesn't matter who you use, if you have your own database that you've created, or OPI, or Futura, or one of the organizations, the record-keeping organizations that you could use. It'll take them 2 minutes to get up and running in that. So no matter what, they're very well versed in these areas. They'll require documents. They will ask for your personnel file of all staff members, and they'll check that. And for each fitter, certified fitter, they're going to require at least 10 patient records, okay? And if you're doing a lot of business, the patient records will probably go within the last 6 months. It depends on your workload and how many your patient load, and they could go all the way back to 12 months. But they're going to pull them at random for about the last 6 months. If you have Medicare patients, this is something we've been doing for probably about the last couple of years. And if you're coming up for renewal, they may not have done this. The survey may not have done this prior to that. But if you have Medicare patients, we're now required to telephone 5 of those Medicare patients. We're required to give them a call and ask them questions such as, did you receive such and such from this boutique, from this practice? How is that working for you? Are there any issues? If there are any issues and they would like to make an appointment to come back in, then they will either either hand the phone over to someone at your practice who will be able to do that in your business, or they will take information down. And as soon as they're done with that, they will hand it to your staff to make sure you call Mrs. Smith would like to come back in about such and such, and they'll give that to you. Now, as I mentioned, we are required to make 5 phone calls to Medicare patients. If you know this day and age, when you make 5 telephone calls, how often are you going to get 5 answers out of 5 calls? It's very rare on that. If they do not get any answers, then they're probably going to make a few more phone calls. They want to get at least 1 or 2 people to make sure they do contact some of your Medicare patients in that, just to make sure that we're doing our job as well. And then there'll be a closing and exit interview, and we'll talk a little bit more about that. We have another poll. Megan, are you ready for another poll? So this poll coming up is, do you use the tools in the Compliance Kit Resource Pack that ABC offers? Your choices are: used almost all of them, some of them, none of them, or I had no clue they were available. And if that's your answer, that's okay. We'll talk about that today too. So if you could go ahead and choose one of those, we appreciate that. And I think our responses will probably be coming up very quickly here. So 27% use all of them. That's great. 50% use some of them. Perfect. 5% uses none, and I didn't know they were available. Those are all great answers, because we're going to walk through some of these and coming up right here. So the resource pack that I'm going to be talking about that really is going to help a lot of the work you're doing, the Compliance Kit Resource Pack, hopefully it's going to make your job easier and make sure you're compliant. It's going to live right here on our website. That's the reason we have this shot of our website up here. Once again, it's abcop.org. And all of these tools, everything I'm going to be talking about, since all of you are 100% ABC accredited, these are all at your fingertips right now. And we're going to talk to you. See the red box up there that says My ABC? If you log into that with your accreditation password and username, all of these tools are available. The Compliance Kit Resource Pack is all available to you. And I'd appreciate if you look at it after the webinar. But anyway, we're going to walk through it here. Thanks. So the Compliance Kit itself, as you can see, we have there's about 26 tools and resources that we have in here. Okay, and one of the main things, as you can see, is the Mastectomy Facility Accreditation Guide right there, and also the Accreditation Compliance Calendar. Let's talk a little bit about that. Now, the Compliance Calendar, if you're accredited with ABC and you're not receiving this each year for the last 4 or 5 years, I'm going to ask you to get in touch with us, because we want to send this out to you. Now, coming up in December, you're going to have your new version of it for the 2021 year, okay? And you should be receiving that in December. If you don't, please let us know, and we'll send one right out to you. So in the calendar itself, we have 12 opportunities to pick different areas to think about maybe what you could be doing that month to be prepared for your accreditation survey and to be compliant with all of the standards. For example, is March a great month to do your emergency drill? Is August a great month to do your accreditation patient chart surveys? Okay, so it just gives you some really good ideas. A lot of helpful tips is in this calendar, so please feel free to use it. And once again, if you didn't receive it, please let us know. So the resource pack, we have, as I mentioned, all of these available for you. We have charts, information pages, templates, everything. We have 26 forms, charts, templates, and information sheets. We have more every single year. We add more each year. And the reason we add more each year is because, as Megan mentioned earlier, I'm out talking to people all across the country. And we have, I think our first year, we started with 8. That we started this about 5 years ago. And I talked to a lot of business owners and a lot of practice owners and management. And they say, you know what would help? It would really help if you could create such and such. And we'll go back to that department at ABC. We'll work with the marketing department. We'll create a new template, a form and chart, and we'll add that to this resource pack. So it grows every year. And if there's something that you feel that we could help with, let us know. We'd be happy to hear it, and we'd love to be able to create more and more to help you. So the first thing, here's the main thing, the Mastectomy Facility Accreditation Guide. If you don't have this, Please get it. Please read it, review it, revisit it. You can get this on our website. You can download it from our website, once again at abcop.org. But this is where everything starts. We haven't changed things in it, but this is a new version and we've updated it. We are updating it all the time now. So please make sure you have this. If you're taking care of the compliance with your business itself, or you can get 2 or 3 copies, print 2 or 3 copies of them out. I keep one on my desk. I keep one on my desk to look things up all the time. So within this mastectomy facility accreditation guide, there's a few other things. One of the things is we have every single standard, compliance standard listed, and there are 43 standards. Now, those of you who've been in the business for more than 4 or 5 years, if you recall, there used to be over 100 compliance standards for mastectomy boutiques and fitters and businesses. But now we have it down to 43, and we've trimmed that down, and it's much more, I think, workable in this area. All 43 standards are in this guide. If you see in the bold, for example, AD.3.1, your business must have written policies, procedures, on and on and on with that. That is the standard itself in the bold. Below it, there are tips. Basically, what does this mean? What do I need to do to be compliant with the standard? What does my business need to do? What is our surveyor going to be checking to see that we have done? Okay, so this is good information, great information. I would keep that, I would look at it very, very closely. Now, on your survey itself, if you receive, when you receive your information back in your survey, if you receive a P or an N, you're partially compliant or you're non-compliant, then if you see this CAP, this CAP, Corrective Action Plan, that's what it stands for, and I'm going to talk a little bit more about that, but if you see that and beside one of the standards or underneath one of the standards, if you're not compliant in that standard, for example, on the page right here says 80.5, if you are not compliant with that standard, then you will be required to do a corrective action. Okay, and ABC will require you to do that, and I'll tell you a little bit more about that, like I said in the presentation. So this is just great information for you. Also within that guide, this is the Patient Care Accreditation Pre-Application Checklist. Prior to you sending in your renewal application or your first-time application, this is good information. This is basically what the surveyor is going to be looking for. It's all your key areas. It's working with you on how to be prepared. The eligibility criteria, go through this with your business staff. Go through this to make sure that everything is set, so when you do send in the application, a surveyor can come at any time. Once the application paperwork is done within ABC, usually takes a little while, but if we have a surveyor in your area and they have some time to do an extra survey, they may come and do that. So we want you to be prepared. This is great information. This is basically your cheat sheet. So it's great information in here. This is also what can you expect on your survey itself, how to be prepared in all areas for the survey, especially if you're first time. But I know we have a lot of people who are listening today who have really been through it before, and you've got a very good grasp on it. I will tell you, the surveys, pardon me, are getting better and better every year. So that's something we're very proud of. So the guide isn't your only resource. We also have relevant standards tools. We have all of these resources. All of these are considered part of the resource pack. These are all here for you. And with this, if you have any further questions, do not hesitate to contact us. We're happy to walk you through anything with this. I did also mention down at the bottom, the second bullet from bottom, if you're ABC accredited, Cato Fleming Insurance Company broker will offer you a discount with that. But let's go through some of these lists here. This is the relevant standards tool. Now, this tool itself is only online. And what we'll do with this is you go to our website, abcop.org, click on the relevant standards tool. There's a list of products and services you're able to provide. Go through, check that list, put all the checks of anything that you are using and that you're providing. You go ahead and click on the Create PDF, and what that does is it gets a personalized list based on all the selections that you have chosen for your business itself. So if I have Jim's mastectomy boutique, I probably don't have it. We have Megan's mastectomy boutique. It pulls up a specific personalized list of all the standards that apply to your business. If all of those 43 standards don't apply to your business, don't waste time on the ones that don't. So this will give you something to focus on with you and your staff as you're preparing for your on-site survey. It's a very good tool. We also have the most commonly missed standards itself. We've created a list of this. I have the opportunity to talk to our surveyors quite often. I update these lists, and what I'd like to do is start here and kind of go through some of those. I want to take a little closer look and go through some of those lists. Now, number one, not understanding the accreditation standard. If you don't understand a standard, please look through the Mastectomy Facility Accreditation Guide. Go through it with your team. Go through it with your staff. If you still don't understand it, do not hesitate in reaching out to us. Please contact us. I'm going to give you contact information at the end of the presentation. Reach out to us. We will walk you through it. And if we walk you through it, and you go back to your team and you say, this is what ABC said, and they have more questions, well, come back to us. Don't hesitate. The last thing we want to happen, and we hear this sometimes, our surveyors hear it, is when they arrive at your business and they're going through something and say, hey, you're not compliant in this standard, and the response sometimes is, well, I don't even know what that standard means. Well, that's okay, but you kind of want to know what the standard means prior to the surveyor showing up, okay? So just to make sure that you are compliant. So don't hesitate reaching out to us. Please get this facility accreditation guide and spend some time with it. So I'm going to spend some time, speaking of spending some time, I'm going to spend some time on incomplete patient charts. This is one of the main things that we get audited on, our RAC audits. This is one of the main things that we get dinged on by payers, third-party payers. And so we want to make sure, let's go back to documentation, documentation, documentation. Remember that? I started off the presentation with that. So now we're getting into the meat of that, okay? So let's talk about documentation. Incomplete patient charts, the missing documentation. Well, I'm going to break this down a little further. We'd like to see an explanation of steps. If when the surveyor is there and we see documentation missing, the surveyor is going to walk with you and give you explanation of steps of how to get that information in the right place and that documentation in the correct place. It's a great teaching opportunity. So while the surveyor is there, remember I told you we have the consultative approach. They're going to help you with this if anything is missing or incomplete. So staying with the patient standard charts, the intake and assessment. Now, this is something that I get comments sometimes from mastectomy boutiques and businesses saying, we're selling bras, we're doing work with this. Here's something that I truly believe, and ABC truly believes about the work that you are doing. You are truly healthcare professionals. There's no doubt in our mind. You are healthcare professionals. You are providing healthcare to your patients. So I want to make sure that you have the confidence and you have the pride in what you're doing because you are truly healthcare professionals. So as we go through this, please keep that in mind. You assess the patient's needs and use. Did you confirm the accuracy of the prescription when they come into your boutique? Did you formulate a treatment plan? Okay. I truly believe you're all doing this. We believe you're all doing it. But once again, is the documentation suffice? Is the documentation there for the work itself? You've established your goals and outcomes. And it is I have people say, well, do we really need that? Yes, you're providing healthcare. So that is necessary. You're a healthcare provider with that. So moving on with this also, delivery and setup. I will say that there was an article, probably about 24 months ago in one of the O&P magazines that said about 27% of the RAC audits were because of lack of documentation of delivery. That's something that we can knock right out of the park right now. If we can get rid of the 27% of the audits just like that, that's fantastic. So the question is, was the device or was the product delivered in a timely manner? I get the question a lot, what is a timely manner? So I think you can ask yourself, what's a timely manner? If you have something that is not in stock, if you tell your patient and your customer customer that it will be here in 3 days and it's there in 3 days, well, that's definitely a timely manner. If you tell your patient it's going to be here in 3 days and it's not there until 2 weeks later, well, that's not a timely manner. I think basically what we're looking here is we're looking at the communication that you have between you and your patient. If you know something's going to take 2 weeks or 3 weeks to get in because there's a backlog with the manufacturer, if you know that's the case, and you share that information with the patient, well, that's timely manner. Is there something you may be able to do with the patient in the meantime? Then that's perfect also. But it's the communication, I think, that you have with your patient itself. Was the item or service consistent with the prescription? Did you check that? Did you document that? Now, talking about proof of delivery, we have the needed beneficiary's name, the delivery address, the date, sufficient detailed description of the items being delivered, the quantity delivered, and of course, we need the signature on that as well. And that's very important to have. So the training instructions were instructions given to the patient or caregiver. You spend time with the patient. I know you do. You spend time with the caregiver if that's the case. I know you do. We have no doubt you do it. And we have no doubt that you give instructions that. Have you documented that in the patient's chart that that information has been shared? The necessary supplies to attach, maintain, and clean information. Have you documented that has been given? And this one gets me right here. How to use, adjust, maintain, clean, inspect skin, report problems, sign of edema, reporting problems. They're your patients. They know where you are, or you go to them possibly. And so they should know how to report problems to you. But have we documented that they know how to report problems? What if there's an issue after hours? Is there some way they're able to get in touch with you at that point? Has that information been given to the patient and your customer for that? Okay, we just may need to make sure that that is documented. So for follow-up, did your follow-up provided consistent with the items or services? Did you review or make changes to a treatment plan? Every patient, every person has had a patient that maybe is moving more rapidly or maybe not as rapid as you would anticipate. And so you make changes to that treatment plan. That's perfectly fine. You are the expert in this profession. You are the healthcare provider. So you have every right to make those changes for the patient themselves. If you've done that, once again, has it been documented? So just make sure, once again, check that documentation for that. Did you review the recommended maintenance with the patient itself? I know you did. There's no doubt. Make sure it's documented. And did you solicit feedback to determine the effectiveness of the patient, if that is appropriate for that? We need the documentation for that also. I've used this story. I was in a practice once, an O&P practice, where I was going through the patient's chart with the surveyor, and there was a white sheet of paper. And on the top of the paper, it was written in black ink. It was a paragraph that said basically the device was the patient, and da-da-da-da-da, and it seemed to work fine, and da-da. Then there was about an inch space, and then another paragraph written in black with the same ink, the same handwriting, and said basically the same information, but you could tell it was written in a different voice. And that was basically the feedback to determine the effectiveness from the patient. But it was insufficient. That documentation was completely insufficient because that's all that was on the page. It didn't state something to the effect of patient said da 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 da. And then you, as the mastectomy fitter, says da 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 da, you date it and sign it, then that's sufficient. That's sufficient documentation. We just want to make sure that you are covered. You do a lot of work. The last thing we want is you not to be compensated for the work that you provide. We want to make sure that you get paid for all the hard work that you do. Oh, I got that feeling. We got another poll coming up. Megan, can we see the next poll, please? So how often do you perform patient chart audits? Do you perform your patient chart audits at least once a year? Do you do it quarterly? Do you do it monthly? Or do you do it as needed? So just take a few moments and think that through. And if you could go ahead and put your selection down, we'd appreciate that. And I think we can go ahead and take a look at the results. So at least once a year, 40%, that's great. Quarterly, 20%, monthly, 20%, and as needed, 20%. Very good responses. And that leads me into my transition into the next area. This is what ABC has put together for you. This is one of those tools. If you see down the right-hand side, that cube down there, that's the resource pack. Whenever you see that cube on the slide, that means this is in the pack. This is for you. With ABC, you will find that the standard is you need to do a patient chart audit at least once a year. At least once every 12 months with ABC. That is the standard with ABC. I loved when I saw that some of you are doing it quarterly, some of you do it monthly. I go to some of the different businesses and they say, oh, we do it once a month. We do it once a month. I don't know how you learn. I learn by seeing things. If you tell me something, I will listen to it and I will do my best to put it in my head. But if you put something down in front of me, that's the way I learn. Everyone learns differently. I truly believe if you use a template like this, or if you have one of your own that you're already using and it works great for you, then stick with yours. We're just putting these out for anyone who would like to use those who are already accredited with ABC. So with this patient chart audit, I truly believe if you take a random audit of your patient's charts, okay? Put the information down that what is missing. So the documentation that's missing in the chart itself. And let's say the first time you do it, you do a random audit of maybe 25 charts, and you put 7 things down of things that are missing in charts. I suggest do it again a couple months later with different charts, newer charts, and start going through it. And I truly believe that if you put this down in writing, this list and this template's going to get shorter and shorter and shorter every month, because you are going to make sure that that documentation and that information is where it needs to be. So this is just one of the things that we can help you with. And if you pull this up, if a surveyor comes and say, I need documentation to see that you're doing your patient chart audit, and you use something like this is what they're going to say, and it's going to be very sufficient for the surveyor, for ABC surveyor. Once again, this is at your fingertips. So the next thing I'm going to talk about is missing or incomplete information for privileging staff, okay? One of the things that we need is a written objective criteria. We need the training, we need justification, and we need documentation. Now, privileging, ABC has standards in other areas that you must be a credentialed person to be privileged. That is not the case with our mastectomy boutiques and mastectomy businesses and facilities. That's not the case. You still may be privileged if you're a non-credentialed staff member. So I'm going to read one of the standards here. I'm going to just take this straight out from our mastectomy facility accreditation guide. It says you may privilege non-credential or non-licensed staff to provide patient care under supervision. It's important, under supervision of a credentialed or licensed individual. That would be the mastectomy certified fitter, practicing within their scope of practice. If you privilege a staff member, your process must be in compliance with applicable laws within that state, based on the written objective criteria, and under indirect supervision of a credentialed or licensed individual practicing within their scope of practice again. You may privilege credentialed staff to provide patient care beyond their ABC-defined scope of practice. Whew, that's a mouthful. So we're looking to be privileged. We must have indirect supervision with a mastectomy fitter or a licensed fitter. Now, the written objective criteria, and I'm going to give you some more information on the next couple of slides, but it's basically saying, how did this person come to be able to be privileged? How did your staff member come? Okay, we need to see the justification. Why do you need to privilege this person? Is maybe you, as a certified mastectomy fitter, can be doing something else with another patient, while this person could be something maybe less on a level to be doing that. We need to see the training. We need documentation of all of that information. Now, in the resource pack, we're going to help you with this. This is really detailed, good information for you. We have instructions for establishing privileging criteria. That is in the resource pack. It's great information. We have a privileging guide. That's excellent information also. If you have any questions about this information's in there. Privileging can be extremely helpful within the mastectomy profession. It can be extremely helpful, but I do want to make sure you're completely aware that anyone who is privileged, it is the responsibility of the person who is certified, mastectomy fitter or the licensed fitter, that they are the supervisor, and kind of the buck stops there with them. Okay, so just keep that in mind. Along the same lines, we have an individual privileging record template. So for example, the employee is Sophia Monroe, the supervisor Maria Perez. On October 4th, 20th, they were privileged in measuring for post-mastectomy bra. The experience attended an online workshop sponsored by the manufacturer of that work itself, the device itself, the product. Proof of the attendance of the workshop is in Sophia's personnel file. This information will be kept in the person who is privileged, their personnel file. And then we also see fitting a unilateral foam breast form, and we see the experience that is that person who is privileged getting continuing education. I hope so, because that is also required. So just as if you who are certified and you're privileging someone, that person who is privileged also needs to get their continued education within the device's specific device and specific guide here. Okay, so this is great information. This is, I think, can help you greatly with this. So you as the supervisor, what is your responsibility? So your responsibility is you review the notes in the patient's chart, because the person who's being privileged is going to put the notes in the patient's chart. You need to review those notes. You need to co-sign the patient's chart, which means basically when you co-sign it, you're saying, I agree with these notes and I agree with this person my employee has done. And you're going to need to date that within 15 days. 15 days. Today is Tuesday. Can you tell me what you had for lunch on Friday? I have no clue what I had for lunch Friday. If I took probably 5 minutes, I probably could figure it out and remember that. We forget things. ABC is being very generous. Medicare is being very generous with 15 days. ABC is generous with this. I would urge you to go ahead and review those notes, co-sign the patient's charts, and do it less than 15 days. 50 days is fine, because that's the rules we have. That's the standard we have. But I do know some business mastectomy fitters who will not let the patient leave without them reviewing the chart right then and there. They want to make sure that everything has been done correctly, because remember, the buck does stop with you. Okay? Something to keep in mind. Another poll. Megan, whoops, oh, I apologize. What's our poll, Megan? And this poll is, how do you offer patient satisfaction surveys? Okay, do you offer it as a hard copy, by mail, electronically, in person, or do you use a combination of the different methods itself? Now, I'm going to go ahead and give you a few moments to fill this in. And I think we can go ahead and take a look at our results. So 44% hard copy, excellent. No one sends them by mail, interesting. No one sends them electronically in this group. In person, 28%, and use a combination of methods, 28% as well. Excellent information, excellent information. I do want to state that, oops, move on to the next slide here, that we do need to do patient satisfaction surveys, and every one of your patients or customers should receive one. Okay, so that's the standard with ABC. So let's take a look at this. First of all, why do we do these? That's the big question. Why do we do it? Because ABC makes us do them, right? Well, that's one answer, yes. But I think basically we're looking at this as we need to extract information back from our patients. It's great to hear that we're doing very well, but we need to make sure that we get feedback for a way that we can improve the healthcare we're providing. Ultimately, you're in business because you want to help your patients. You want to help your customers. I think this is one of the great ways we can do it. Everyone offers satisfaction surveys. You go to a fast food restaurant, they're sitting on a table sometimes. Everyone offers them, but we need to make them accessible. I like that some of you are giving a lot of the hard copies. You're doing it in person. I think you should know your audience. You should know your audience. My father was a vice president of a structural steel corporation. He had an email address at his office before he retired. My father never once in his life opened an email. I will tell you right now, he never once in his life opened an email. Okay, so it's a waste sending my dad an email. giving us something hard copy, he will sit down and he will do it by hand. I travel a lot. If you give me a hard copy, it's going to go in my backpack or my bag, and it's probably going to get lost. And so if you send me an electronic version, I'm going to sit on my phone and I'm going to fill it out for you. So know your patients, okay? Make them accessible, make them relevant. Please, what we want to do is get information that's going to help you provide the best health care. I've seen patient satisfaction surveys that ask if they like the brand of coffee that they provided in an area at their business itself. That's a feel good, but is that really relevant to what's going on? Okay, make them timely. I loved saying you give them a hard copy or you do it in person. That means you're doing it in a timely manner. And I would take this last thing to explain the importance. It really, truly is important. If you, as the fitter, or you're working with your patient or your customer, take a few moments to say, we're going to give you this patient satisfaction survey, if you're doing it by hand or in person, and say something to the point and put it in your own words. We want to make sure that we are doing everything we can in the best, most possible, best way to help our patients. We want to make sure that you feel confident that if you're in church this Sunday and you see someone who needs the services we provide, you feel extremely confident in sending that person. We want to feel confident. We want you to feel confident that if you have a member of your family who needs the services we provide, that you will be happy to send them to us. We want to make sure that we're doing well in that area. So with
Hey, Jim.
this, yes.
Hey, I just wanted to give you a 15-minute mark
Oh,
for out of 2 o'clock.
Okay, very good. We're going to go through pretty quickly here. In the resource pack, we have how to write, analyze, and patient satisfaction surveys. We also have a sample patient satisfaction surveys that you can take and use completely on your own. If you would like to take this and put your own logo on it, it's yours, period. So don't forget that. What do you do with the results? Please evaluate the responses, read those, rectify the problems, reach out to the people if there is an issue. It's a great learning opportunity, and this is a great marketing opportunity. If you do want to do a one-pager saying, this is what our patients are saying about us, 98% of our patients say they would certainly come back to us or send people to us, then maybe that's someone you would like to send to maybe some of the cancer centers or some of the hospitals and say, here we are. Everyone's doing fire and emergency drills, I hope. We need to do this at least once a year. We need to update our emergency plans at least once a year. Every employee needs to go through a fire drill. If you're going to hold a fire drill with patients there or customers in your business, be kind to them. Let them know it's just a drill at that point. But we need to do it, and we need documentation for that. Here's documentation. It's in the resource pack. There's the date, the attendees, the start time, the stop time, and the scenario. That's what the surveyor would like to see, something like that, okay? Safety inspection is no longer a standard for mastectomy clinics, as mastectomy boutiques and facilities, but it's a good business practice. Please take some time when you're not as busy, go through it. Make sure your fire extinguishers are working. Make sure the carpeting's not frayed. Make sure where people maybe trip or something like that. Please do a safety inspection of your business itself. We need our policy procedure manuals. Every business has one. It needs to be accessible to all staff. It's a living and breathing document. I will tell you it needs to be reviewed at least annually, and your surveyor will check to see that it is done. We also have a billings and claims. They need to make sure that your clinical are matching your billing. They don't need to know that you're doing fantastic or just getting by. They need to make sure you have a budget that you're following with this. And along the same lines, in the resource pack, we have the billing and coding error report, just like the patient chart documentation. Fill that out. If there's errors, fill it out, do it again the next month. The next month, it will get shorter and shorter each month. I mentioned before there will be an exit interview and a closing interview. This is an opportunity to speak with the surveyor face-to-face. They're going to go over your positive findings, your non or partial compliant issues. It's a great chance to share the information. They will not be able to tell you whether you have passed or not, but you're going to get a pretty good feel of that when you're going through of your non and partial compliance standards itself. They'll also give you some great business suggestions. Their job is to make sure you're compliant with the standards, but they will give you some really good information that take advantage of that. I'm going to kind of skip through here. This is the corrective action plan that I mentioned before. If you have one of these and you're required to do one for ABC, we will give you 60 days to complete it. As you see these boxes, the first standard is compliant, next one is non, the end, compliant, then we have a partially compliant. If this is your corrective action plan, those two standards, you would need to show ABC how you are now compliant with that. And we have 60 days to work with you with that. So congratulations, you now have your certificate. It's sent out to you, it's updated to you. What happens next? We're going to send you a template that you can broadcast your success. It's a news release. You send it to those who you would like for referral sources. It's great. Also, local newspapers, send it to them, telling them this is who you are. Facilitator is an electronically quarterly email that if you're not receiving this and you're accredited with ABC, let me know. I'll make sure that you do start receiving this. It's great information here. I'm going to jump right to this. This is our website. This is a photograph of our staff. I'm lying to you. This is not our staff. I'm not that handsome. So this is our website, abcop.org. This is where everything belongs that I've talked to you about. This is our accreditation team. These are the people who will get on the line with you and walk you through everything. Tammy Richards, fantastic director of facility accreditation services, knows these standards like the back of her hand. Christine Michael, she's wonderful at working with you, fantastic work with you on the phone. And Kyle Sens, who knows the standards compliance. He's a specialist at this. These three people are going to be able to help you extremely well. And with this is their email address. If you write to them at accreditation@abcop.org, they will respond to you and get it right back to you. Now, the reason I'm kind of zipping through here is because I'm going to give some time for some questions. Megan, do we have any questions possible?
We actually don't have any questions at the moment, but if you
what I'm
have,
going to do, I'm going to go back and start the whole presentation over again, and then maybe someone will think of questions at that point. No, but that's perfectly fine. There's no questions. That's great. A couple of things I would like to reiterate. Get that facility accreditation booklet, okay, our guide. Please get a copy of that guide. Go to our website at abcop.org and download it. Feel free, anyone can download it, but get a copy of it, okay? And if you don't want to download it, let us know. I will send you a hard copy, okay? Just reach out to me. I'm going to give you my contact information also with that. The second thing is we're going to give you the 4-week window when the surveyor is coming to your practice itself, okay? And so that's going to be helpful, okay? But once again, walk through this guidebook, walk through the pre-application. Okay, we have the pre-application list. I encourage you to walk through that with your staff because unless you're a one-person business, everyone on your staff is going to have some sort of help with being compliant with the ABC accreditation standards. And it's basically, I like to look at the standards as this is really best business practices, how to run an efficient, helping, great patient care facility, and that's exactly what you have. Did I see a question come up, Megan?
Yep, we've got one. So Jerry's asking, how many years do you need to keep the info in the patient's files?
I am not a CMS specialist. I'm not a Medicare specialist. I think it is 7 years, but I am not 100% sure. We will get that answer for you, okay? That is an answer that one of those 3 accreditation specialists that Tammy, Christine, and Kyle would be able to answer for us on that. But we will get that answer 100% to make sure it's suffice for you.
If anybody's wondering where you put the Q&A, if you do have a question, you just need to click on the Q&A button and go ahead and start typing in. We actually have one more question, Jim.
Great.
Okay, Sandra's asking, with COVID, I don't want them to be signing and touching all the papers. What do we suggest that they do?
I'm not sure if you mean your patients, your customers, or the surveyors who come in. We truly want everything, and we respect everyone's wishes when it comes to being safe. 100%. I probably need to know a little bit more about. I think, for example, I have been places where I've been into my doctor's office and I do need to sign things. My doctor's office will give me a pen to sign the form, and then they immediately take it back and they clean the pen off. They probably have 15 or 20 pens ready for me to sign the documentation, and they immediately clean with with the right scrub and the sanitizer to make sure that pen is now sufficiently clean for someone else to use it. We do need the signatures. And it's still needed dated and signed, but most of the time the signatures you're talking about is either your electronic medical records that we've been discussing or staff signatures in the patient's charts if you still are using the hard copies of the charts themselves. I encourage everyone to be as safe as possible. ABC encourages everyone to be as safe as possible. Our COVID-19 page may help with that, but I think we still do need the signatures, so you take that extra step. I would encourage you to take that extra step and go ahead and cleanse all the materials that you'll be using and that your customers and patients will be using.
Great. Okay, Jim, we've got another question that came in. Katie is asking, they're thinking about going paperless and wants to know if they have to have paper files for the ABC site visits.
No, the surveyors I mentioned before, the surveyors are very well accustomed to the electronic medical records. If you're going full electronic, that's perfectly fine. It depends on, I think, the period of, we know that accreditation with ABC is a 3-year cycle. And so, for example, if you have enough documentation over the last year prior to the surveyor coming to their next survey electronically, then that's fantastic. That's great. So, for example, I'm just making it a scenario. If a surveyor is coming, if you're changing your records over to electronic medical records this month, but we know the surveyor is going to be coming within the next month or two, then you may not have all of those records electronically yet. Okay, so you may still want the hard copies, and the surveyor may take a look at the hard copies. But for example, if you've switched over to your electronic medical records, and a year from now, the surveyors to come to take survey to take place, then you're going to have enough medical records within that last annual year, 12 months, for the surveyor to have enough information, documentation, to go ahead and perform that survey itself.
Great. And I don't see any other questions coming in right now. Was there anything else that you wanted to reiterate?
Yeah, I just want to reiterate a couple of things. Megan, thank you. Before we go ahead and take off, the webinar, Megan, you can say the webinar recording is going to be available. Is that correct?
Yes, yes, it is being recorded and it will be available to everyone in about 1 to 2 days. And we will send out a follow-up email, and you can also check our website, our webinar library. We'll have all of the recordings there as well as links to the quiz.
Very good. And you mentioned before that the quiz is available. If anyone would like this recording, like Wendy, Megan said, it will go out, and feel free to share this. If you feel you've gotten good information from this, if you feel like we've shared enough information, feel free to share it with your team, with your staff. Even if someone is not certified, that's perfectly fine. This is still good information from them. Maybe they'll think of something to request for, maybe something we can add into the resource pack for next year. So yes. This is my.
And just 1 second, Jim. I was going to just let everybody know. Take a look at the chat box. I did, like I had promised earlier, I did put the link for the quiz as well in the chat box. If anybody wants to go ahead and take that, you can copy that out of the chat and put it in your web browser and go ahead and take the quiz. So if you're anxious to do that, it is available for you. If not, you can wait till we send out the follow-up email or check the website where our webinar library is.
Thank you, Megan. That's great. And want to be respectful of everyone's time. Here's my contact information. If you have any questions, feel free to reach out. I will make sure that we get the right person reaching back to you and the right information coming back to you. Please don't hesitate. Feel to use me as a conduit. I will get you to the right person. And we thank you so much. We thank you for the work you're doing. ABC thanks you for the work you're doing and the healthcare you're providing to your patients. It's challenging in this time. We know that. We see it every single day. It is very challenging, especially with the virus. And we thank you, really thank you for the work you're doing, and bless you for that work. Any questions? Don't hesitate. I hope you have a wonderful day. Thank you, Megan.
Thanks, everybody. Have a great one.